Welcome to our training session on basic first aid. Introduction to First Aid and CPR. What is first aid? First aid is the immediate assistance or treatment given to someone who is injured or suddenly becomes ill before professional medical help is available. The primary objectives of first aid are to preserve life, prevent the condition from worsening, and promote recovery. First aid can range from simple procedures like applying a bandage, to more complex interventions such as performing cardiopulmonary resuscitation, CPR. Preserve life. The foremost aim is to prevent death. This may involve stopping severe bleeding, performing CPR, or ensuring an open airway. Prevent the condition from worsening. This includes managing injuries to prevent complications, such as immobilizing a fractured limb to prevent further injury. Promote recovery, helping the injured or ill person recover more quickly by providing appropriate care, reassurance, and comfort until medical professionals take over. Importance of first aid and CPR training. First aid and CPR training equip individuals with the necessary skills and competence to act during emergencies. This knowledge is vital because in many cases, the first few minutes following an emergency are critical. Effective first aid and CPR can stabilize a person until professional medical help arrives. Legal aspects of first aid. Before administering first aid, it's crucial to understand the legal aspects to protect yourself from liability. Consent. Always seek consent before providing first aid. If the person is conscious, explain what you intend to do and obtain their agreement. If the person is unconscious or unable to respond, consent is implied. Good Samaritan laws. These laws protect individuals who assist in an emergency from legal liability, provided they act in good faith, within their level of training, and do not exhibit gross negligence. Documentation. If you provide first aid, document the incident as soon as possible. Include details such as the time, what happened, what you observed, the care you provided, and any statements made by the injured person. This documentation can be crucial if questions arise later. Responding to emergencies. Steps to take in an emergency. When faced with an emergency, it's important to follow a structured approach to ensure that you act quickly and effectively. 1. Recognize the emergency. The first step is to recognize that an emergency is occurring. Emergencies can be obvious, like a car accident, or less apparent, such as someone suddenly becoming unresponsive. Trust your instincts and err on the side of caution. 2. Check the scene. Before rushing to help, quickly assess the scene for safety. Look for potential dangers like fire, toxic fumes, or oncoming traffic. Your safety is paramount because if you become injured, you won't be able to help others. 3. Check the person. Approach the injured or ill person and check their condition. Assess their airway, breathing, and circulation, ABCs. Look for signs of life-threatening conditions, such as severe bleeding or unconsciousness. 4. Call for help. As soon as you determine that an emergency exists, call emergency services, 911, or your local equivalent. Provide the dispatcher with clear information, including your location, the nature of the emergency, and the condition of the person. 5. Provide care. After calling for help, provide the necessary first aid. This might include performing CPR, controlling bleeding, or treating for shock. Continue to monitor the person's condition and offer reassurance until professional help arrives. Chain of survival behaviors. The chain of survival is a series of actions that, when performed in sequence, can improve the chances of survival following a cardiac arrest. Each link in the chain is crucial for the overall effectiveness of the response. 1. Early recognition and call for help. Recognizing cardiac arrest and immediately calling for emergency medical services is the first step. 2. Early CPR. Starting CPR quickly helps maintain blood flow to the brain and heart. 3. Rapid defibrillation. Using an AED as soon as possible to restore a normal heart rhythm is critical. 4. Effective advanced life support. Paramedics or other healthcare providers can provide advanced life support, including airway management, medications, and stabilization. 5. Post-cardiac arrest care. Once the person is resuscitated, they need ongoing care to address any underlying conditions and support recovery. Psychological first aid. In addition to physical first aid, providing psychological first aid is essential during and after an emergency. People involved in or witnessing an emergency may experience shock, fear, anxiety, or confusion. Simple steps such as speaking calmly, offering reassurance, and listening to the person's concerns can significantly impact their emotional well-being. Thank you for watching Basic First Aid Module. Please answer the questions for this training before moving on to the next training module.